work it, make it, do it, makes us older, better, faster, stronger.
The popularity of hypoxia-inducing devices are growing rapidly in the athletic world, such as the one shown in the video. But what are people using it for exactly, in hopes of improving their performance? This device creates a hypoxic environment, meaning that people deprive themselves of adequate oxygen in hopes to stimulate a higher altitude and train their inspiratory muscles. While this might be slightly helpful in improving performance, this is also very dangerous because creating an environment that lacks adequate oxygen may have more disadvantages than advantages. The effects of hypoxia on athletes due to higher altitudes interfere negatively with their performance by decreasing pulmonary function, decreasing muscle oxygen uptake, and causing sicknesses.
To test the effects of hypoxic conditions on the body, scientists can stimulate an altitude if they are not in a high altitude place or simply visit a high altitude place. Stimulated altitude is referred to as normbaric altitude. Normbaric altitude is also called fake altitude because it has low oxygen but normal pressure, whereas hyperbaric or real altitude has low pressure and low oxygen.
Studies have been conducted in both normobaric and hypobaric conditions that suggest that hypoxic conditions result in decreased oxygen to the muscles as well as decreased vital capacity. Hikers, endurance athletes, cyclists, and physically active men have been part of these studies in order to figure out the effects of performance on hypoxic conditions. One interesting thing that was found was that recovery from oxidative stress was blunted in individuals in hypoxic conditions due to the lack of oxygen reaching the muscles. This is due to a lower oxygen content available at the high altitude. However, results from these types of studies should be looked at with a grain of salt because we do not have enough information to make a for sure statement.
Does training in a hypoxic environment do more bad than good for an athlete? In low to moderate altitudes, symptoms of acute mountain sickness, also known as AMS, are commonly seen in athletes, and even higher altitudes, more serious diseases such as pulmonary and cerebral edema can develop that can lead to serious psychological and physical impairment. For an athlete, being healthy is important for athletic performance, so with hypoxic environments potentially creating an environment that causes an individual to experience sickness or disease, this can affect not only their health, but their performance as well.
Performance in low intensity or power sports are not nearly as affected as in endurance sports at higher altitudes. This is because endurance sports are affected to a greater extent due to the lowered forced vital capacity. Sports that are short, high intensity may actually improve due to less dense air and reliance on anaerobic metabolism.
Since altitudes vary around the world, this brings up a good question. Where should the Olympics Games be held? Also, should they hold it in a neutral place? For example, the 2008 Summer Olympics were held in Beijing, China, a place of higher elevation and air pollution. Athletes worried about their health because of poor air conditions. This environment is not good for athletes trying to perform their best. Also, when held at lower altitudes, athletes who come from higher elevation may have an advantage because breathing can feel easier at lower altitudes. So really, how can we make this as fair as possible? To combat the possible effects of hypoxia, a neutral environment would make the playing field fair. When it comes to sports and athletes who train at a higher altitude environment, such as the Denver Broncos, they will have an advantage over athletes who train at a lower altitude environment, like the Miami Dolphins. The Denver Broncos play in a stadium that is a mile high above sea level, hence the name Mile High Stadium. The Miami Dolphins play at the sea level. There are some teams that play below sea level, but we're looking at the Miami Dolphins in this format. When the Miami Dolphins travel to the Denver Broncos Stadium, they will experience hypoxic environmental situations. They will not be able to perform to their best caliber, such as the VO2 max. They will be gasping for air and will not be able to compete as well as the Denver Broncos, because the Denver Broncos are already used to the higher elevation settings. Also, anybody from the Miami Dolphins who have sickle cell traits will not be able to make the trip over to the Denver Broncos Stadium because sickle cell and hypoxic environments do not mix well and could lead to possible death.
Sickle cell anemia is a blood disorder that affects hemoglobin, which is a protein found in red blood cells. Red blood cells help bring oxygen to the body, so in a hypoxic environment, which lacks adequate oxygen, this makes it challenging for people that have this disease to get oxygen and can result in slowing or blocking blood flow. This will not allow muscles or body systems to function effectively, resulting in decreased performance. The idea of training in a hypoxic environment in order to strengthen a person's inspiratory muscles to hopefully improve performance is a fair idea, but we need to look at how the oxygen intake affects the human body and the body systems. Our body relies on oxygen to help pump blood, help the brain function properly, and other regulatory functions, so limiting oxygen intake is not ideal for the human body. A technique such as a Valsalva maneuver, which requires holding your breath, can be used to test the body's ability to compensate for changes in venous return of blood, but holding your breath too long and not inhaling oxygen can result in passing out, and that's not healthy for your body. So is it really worth the risks of training in a hypoxic environment to possibly improve athletic performance? Scientists are not able to provide a sound answer, so it's ultimately up to the individual to take the risk or not.